It is Friday, April 3rd, and welcome to our daily update. We are the Kahnawake COVID-19 Task Force. Today we have a very busy program. We have, just like last Friday, Dr. Annick Gauthier will be here to answer some of the medical questions, as well as our usual updates. Today, something a little different. We're trying some new technology, and we'd like to welcome, off the top of the show, Grand Chief Joseph Tokwiro Norton, who has been in isolation. He got back from his vacation and had to go right into isolation. I've spoken to him several times, but for the first time in several weeks, I get to see him here. Tokwiro, welcome along.
Thank you, Joe.
Okay, so just because you're not in the office doesn't mean no work is going on. So perhaps you can tell the people of Kahnawake and beyond what you've been up to.
Yeah, I guess contrary to what some people think, we're not just sitting at home and getting fat. We're actually every day there's something going on. There's usually we start our day at 9 o'clock and we have a brief 1 hour gathering on various topics and subjects. Gathering, I mean by calling in, calling in from here, from your home, your isolated area. And for about an hour, then at 10 a.m., Lloyd Phillips will come in and he'll update us on the most recent issues that have been happening, what's been taking place, and looking for suggestions and comments from the council to, I guess, to provide any information or ideas we may want to present to him in terms of how we view things. And then there's comments and suggestions. There's, I guess, what have we seen lately, sort of, and then after that we'll go maybe till noon sometimes. Recently it hasn't been as long as that, but generally it's been around noon. And then people scatter in the sense that they have their own. All the chiefs have their own portfolios and meetings via phones, by Zoom, and all the different new technology that's come in to deal with matters that are pressing. Business does not stop. We have to keep going. Every Monday morning or Monday for the day, it's dedicated to council meetings. There's all kinds of business that has to be taken care of. So we'll meet all day Monday generally, and then on Tuesday we have strategic sessions. And there's a variety of issues that also need to be addressed and focused in on. So it's a very busy. I guess this is my third week of isolation. So it's been very, very busy. It's not been. There's been some idle time here and there, but otherwise it's just constantly busy. On the weekends, in the evening, there's a chat line that we have. And there's a lot of information that's been going back and forth in terms of, the latest information, some incidents, some things that have been happening. I mean, this whole issue about the closure of business, in particular the tobacco industry, which in turn has been drawing non-natives to the community. And people are out there still looking. They're looking for where can we go to buy tobacco, and the PKs have been out there on their toes and getting after people, telling them we have to leave. So we've planned out a way of dealing with that in terms of posting signs and having people out there as much as possible to persuade the non-native people that that we're not selling tobacco anymore. Don't be here, not because we don't want you, simply because of the contact wherever you're coming from. You might be bringing that scourge with you. So we have to make people aware that they can't be doing that. And we're working on a number of other fronts with the surrounding municipalities. We're going to be beginning to talk to what they call the Montérégie, the MRC, speak to them about cooperating with us and working with us so that they can talk to their citizens and explain to them. Unless you're using Kahnawake just to go to the city or something like that, they're not open for business. Don't go there, you know. Follow what the Prime Minister has been saying, what the Premier has been saying, and what we're saying here in Kahnawake too. You know, the whole thing about being careful about keeping so many kilometers apart, meters, and you know, be careful about what you do. And even in town over here, there's still a lot of work that needs to be done. So we're on top of things, and we're trying to keep, and everybody, all 12 members of the council, we all have a portfolio, we all have a duty, and we meet periodically like what we're doing now, and then we split and go our way and do what has to get done.
Just a question before you leave. Is there anything else you'd like to touch on that perhaps, you know, looking at the different, say, you've been through several different crises over the years. Going back 30 years ago, we had the Oka crisis. We've had a few since then. Today's crisis, what can you tell us about the difference between this and any other thing that you've been through as Grand Chief, because you've been for a long time?
Well, there was the ice storm too, don't forget. And then previous to that, way back when I was a young iron worker, people forget about the October crisis, 1970. Actually, they blew up the lift bridge over here, right where I used to live. They set a bomb, and we had to live through that too, because you had the military all around Kahnawake, stopping everybody, checking them, guarding all the pylons, the electric lines, the hydro tower lines, and all of that. So I remember that too. So there's like 4 occasions in which, and this one is so different because, as people have been saying, you know, there's the enemy is a disease. The enemy is not something that you can or want to put your hands on, in other words, and it seems like it's just continuing to go, and the only way we seem to be able to fight it is distance ourselves from each other, which is difficult. I mean, I have 2 grandsons. I'd like to see them, you know, I'd like to be with them, but unfortunately I can't at this moment. My daughter, my son, you know, so those are the heartfelt things that we all are going through right now. So it's not easy. You know, you, after being isolated, self-isolated for 14 days, you say, oh, I got freedom. Well, where do you go? What do you do? You know, none of the things you enjoy, like going to restaurants or shopping or doing this or doing that. Even maybe going to Montreal, we may be isolated from going to the city, but what's there for us anyway at this point? So, you know, from a personal point of view, I just like to add that as I guess a reminder that, you know, there's some of us that are still around remember all those different times, periods in our lives when these kinds of things happen. But this is so different, so different.
All right. Grand Chief Joseph Tokwiro Norton, Yaokoa.
Yo.
All right. And, well, our next interview is with Vickie Coury. She's the manager of assisted living services at Gauthier, the Genhas Community Services. She also joins us from a remote location. And Vickie, first of all, welcome. Secondly, you may be the manager of assisted living services, but now, as of today, you're doing other things. So tell us a little bit about what's going on with you now.
Okay, Nyawa, Joe. Yes, although I've been the manager of assisted living services for a number of years, as of this morning, I took on a new task. This came about through the COVID-19 task force, who had identified a need that was growing in the community. So as of this morning, I have taken over coordination of an isolation shelter. It's very specific, and I have good news. We were busy all day today since about 10 o'clock with this task, trying to organize ourselves here in the community so that we can answer a need that was identified through the task force. The emergency isolation shelter is very specific at this point in time, and I want to make the community aware of that. So the priorities that will be serviced through this resource now is, number one, to provide a safe environment where are people that right now may be on the other side of the border, whether it's the provincial border, the United States border, you know, some of our iron workers who have been stuck on the other side, if you will, and need to come home. So this emergency resource shelter will be for those individuals who can't, for whatever reason, may not be able to go home to their family at this point in time and need to respect that 14-day self-isolation period. Joe mentioned he had been on it when he came back from his vacation. Right now, I'm still under that mandatory self-isolation myself for another few days because I had been on the other side of the border on March 13th. So while Joe and I, our circumstances might have been able to accommodate us isolating in our home, we recognize that for some of our men or family people in general, they may not have that option to be able to isolate a safe distance from their loved ones, but we still want them home. So as of today, I'm happy to announce that we have been able to set up an emergency isolation shelter for those individuals. In addition, this shelter will be available for some of our essential service workers who either feel that are worried that they might contract something and then bring it home to their families, or are worried that they might catch something somewhere else and bring it to their patients and the people that they're servicing. So in those areas, again, if there's a need, we do have this emergency isolation shelter. The process, I want to make people aware, there will be an intake process for that. So we will be setting out a press release after this show is over with all the information, but for people's benefit now, through community services, during our regular working hours, there will be an intake worker available. All people have to do is call our regular KSCS number, 450-632-6880, and reception will triage them to the intake worker for the emergency isolation shelter. That individual will be there to take all the information, screen them, of course, ask those safety questions that we're all asked, and then help them locate themselves into the shelter.
All right, Vickie, is there anything else you'd like to add?
Yes, I would just like to ask everyone's patience and to remember that this whole thing really started ramping up today. We worked very quickly, especially to try to get people home that have been away for a number of weeks or months and want to come home. So as we move this thing forward, we're going to be evaluating as we go along. We will be making adjustments and updates and you know, trying to meet that need. So I just ask for everybody's patience as we roll this this resource out. Okay, Joe?
Right.
Nyawa.
All right, now go, Vickie. We're going to take a short break. We still have 3 guests to go, including Dr. Annick Gauthier, who will be answering some of the medical questions that have been coming in all week on questions@mck.ca. Stay with us. We'll be back with more of our update in just a moment.
I'm Zuze, and I got one thing to ask you. You wanna go? You wanna go? You wanna go? If you wanna go, then let's go then. Skoden, my patented technique to make sure you stay safe while in quarantine during this pandemic. Let me break it down for you. S for stay. Stay inside. If you feel sick, that's the only way we're gonna stop this from spreading further. K for keeping commonly touched areas clean and disinfected. That means your doorknobs, your countertops, etc. Also, keep your hands nice and washed. Oh! 4. Obey public health advice and social distancing. I get my advice from the Kahnawake 911 Facebook page, and I totally didn't get paid to say that. And also, when you are obeying social distancing, it's good to remind others to do the same. Hi, Jose. Keep your distance, you.
Hey, Jose, can I borrow your VCR?
2 meters away. D. 4. Do not touch your face. E. 4. Emergency! If you find yourself in an emergency, be sure to call the Kahnawake Peacekeepers at 450-632-6505. They paid me to say that. And last but not least, N for nose and mouth etiquette. If you must cough or sneeze and you don't have a tissue around, do it into your elbow. Not here like this, in here. So, let's go then. S for stay inside if you don't feel good. K for keeping commonly used areas clean and disinfected. That also means keeping your hands nice and washed. O for obeying public safety advice and social distancing. D for do not touch your face. E for emergency situations, call the Kahnawake Peacekeepers. N, nose and mouth etiquette. So Kahnawake, do your part. Let's go and stop the spread of COVID-19. Stay safe, stay smart. Uno.
And we are back. You gotta love Jose. Well, we're coming up to the second half of our program today, and Lisa Westaway, the Executive Director at the Kateri Memorial Hospital Center, is here. I don't think she's missed one of these updates yet, and today is no exception. Lisa?
Thank you. Good afternoon. I have a very quick update today, just a little bit of news about the testing site. So up till today, we have tested 87 people. We do not have very many results yet. Like I had mentioned, by Tuesday, I hope to be able to show you a graph so that we can have a better idea of what's happening in the community. I wanted to talk about some things you might be hearing in the news that you might make you wonder what's happening with our testing site. So Premier Legault, in his update yesterday, did announce in his press release that many of the testing sites around Quebec would be changing orientations, meaning that rather than testing all people with symptoms who had a history of contact or travel and or a few other items, instead of testing all of those people, that he would no longer be testing the general population. So he emitted 6 priorities, and if you fall within one of those 6 priorities, then you will be tested. And so what is suggested for the greater Quebec region is that the general population that don't fit within those 6 priorities who develop symptoms should self-isolate for 14 days without question. And so that is what is being recommended presently in Quebec. There are many reasons for that. We had spoke a little bit about it a couple of days ago. One being the fact that there is a serious backlog in testing. There is a lack of experts to do the testing, also lack of reagents to do the testing. But one of the main reasons that was documented in the press release is the fact that several bigger geographical locations have community transmission. And it is felt that once you've reached that point, that it may not be as beneficial to continue testing. It may not give you any more information to be able to make appropriate decisions. So for Kahnawake, we're in a little bit of a different situation. We set up our testing site on Sunday, so it is not quite a week. We're on day 5 today. We've tested, like I said, 87 people. We don't have results, so we don't really yet have a good idea about what's happening in our community. We don't know yet whether we have community transmission or not. We've made some assumptions over the past couple of weeks, but we don't have any clear data that suggests one or the other. And so in discussions with public health, we feel that it's still very pertinent in Kahnawake in particular to test. So if you do look on Quebec.ca website, you would be able to find the press release and the 6 priorities. For Kahnawake, we fall in priority 6, which is a community identified by public health as requiring testing in order to have a better idea of what's happening in the community. We also fall under priority 4. In priority 4, what's being recommended is that any remote areas, any Indigenous communities in remote areas or other communities in remote areas that also have lack of access to hospitals be testing all of their community members. So although we are not remote and although we do have access to hospitals in a close enough distance, we still can continue to test through priority 4. So because of those 2 areas, we are going to continue with our testing site. Of course, as mentioned, directives change on a day-to-day basis. So we're going day by day with respect to these orientations from public health. And again, we hope by next week to have a better idea of what's happening in the population in our community. So we urge you, once you get tested and if you develop symptoms, to self-isolate. That continues. And we also urge you, if you have symptoms, to call again 450-638-3930, extension 2296 or extension 2275, so that we can give you an appointment. We've spoken a little bit in the last couple of days about people who may have a complete inability to come to the drive-through or walk-through testing site. In those instances, then we ask you to still call the same number and let them know about your situation, and we will find ways to ensure that you get tested at home. So it's not a choice of drive-through versus someone coming to your home. We have extremely limited resources to be able to go to people's homes to test. However, we don't want to lose out on the ability to test somebody who has symptoms who absolutely cannot get to the testing site. So please, if you're in that situation, don't be shy to let them know when you call, and we'll be making arrangements to test at home. So it's been 3 full weeks that we've been here, that we've been meeting with you on a day-to-day basis, and I don't know if I could say the weeks went by quickly or really, really slowly. I think there's 2 ways to look at it. However, I just want to say thank you for allowing us into your homes every day and allowing us to make suggestions about restrictions in your day-to-day life. So I know it's not easy. We're used to being independent adult human beings and making our own choices, and our choices have greatly been taken away from us from this situation. So considering that, we thank you very much for following through on the recommendations that we make. And we still believe that this is saving lives and that we have to continue. So with that, I'm going to pass on to the next person, and we'll see you tomorrow. Thanks.
All right, now Elisa. Last week at this time, our daily update featured Dr. Annick Gauthier, who did something a little different. During the week, people were asked to ask some questions, send them in, and she would answer them. The COVID-19 questions, of course. It turned out to be so popular that, well, we're going to have to do it again, and we are doing it again. So we'll let her, for those who didn't see the program last week, we'll have her introduce herself again, because she's a family doctor here, but she's much, much more than that. And when she explains that, you'll see why it's important to have her here. So ladies and gentlemen, once again, Dr. Annick Gauthier.
So my name is Dr. Gauthier, Annick Gauthier. I feel sort of like bragging if I'm describing it again, but so I have family doctor. I changed my career at the age of 38 and decided that I needed to go back to, no, we're not back to med school. They're asking me to wash my hands, and I'm not doing it for a reason. One, I've just washed it, and two, I have a demo, and I need to not wash my hands to show you my demo. The behind-the-scenes people are irritated that I just pointed them out. So basically, me, I decided at the age of 38, after being a virologist and working with viruses for, well, over 15 years, that I wanted to work directly with patients and make changes in the healthcare system. And I knew that just as a PhD wasn't enough, I needed to be an MD PhD. So I went back to med school. But this whole, PhD in virology is coming in quite handy these days. So with that, I'm going to talk a little bit about the questions you've asked. And the main thing, and I said it last time, is that fear is fed by misinformation. So I need you to help relieve your anxiety by getting the correct information. Information is changing. More publications, more scientific publications are coming out daily. How that gets filtered down into the media is sometimes not done so well. So I got a lot of questions about which news effort, like who should I trust? Should I watch Fox? Should I watch CNN? And overall, if you want to watch that for just general information, sure. But if you have like specific questions that are related to your personal health, you should speak to your doctor, your family doctor. We're still available at Kateri. We're doing phone calls. You can book appointments. And your family doctor, if you have a specific question about your health. Now, if it's like a general COVID type question, again, I recommend highly to go to Quebec.ca. You can get it through various places, but literally if you just type Quebec.ca in your browser, it's the first thing you see. It's a big bright yellow panel above the Quebec blue, and you will go there and you press that and it's all the COVID-19 information. And a lot of the information that I'm telling you is all available there. Okay, so the first series of questions, other than the where to get information, is about personal protective equipment. I'm going to make a little shout out to Leslie Walker-Rice now. She's going to kill me for doing this, but Leslie and I, being infectious disease type people, we really care about how we put on and how everyone uses equipment like masks and gloves, and do they use it properly? This is the time where we actually need to really educate everyone. And it's not just educating healthcare workers, but it's also educating the public. So the first question is, shouldn't we be wearing gloves all the time? Can we wash gloves? Can we take them off and put them back on? So my answers are no, no, no. So I'm going to first show you how to use a pair of gloves. Okay, so now I'm going to put the gloves on. By the way, this is just a crappy box, because I'm not using the real healthcare worker gloves. These are from my husband's garage, okay? So now I'm gonna go take it. Oh, but you know what? I actually can't touch this box. And why can't I touch this box? Because I haven't washed my hands. So the first thing you need to do is wash your hands. Now, for the sake of television, we're not gonna wash for 20 seconds, but at home, you'd be washing for 20 seconds, okay? And you do this, okay? So you're washing. So now I can remove my masks. I'm going into this box. So the reason why I had to wash my hands first is because my hands have dirt on them, have bacteria, fomites. That's what they call little particles that are on surfaces. So I put on my gloves. I put on my other gloves. Okay, now I've moved things around. I'm gonna move this box. I'm touching my computer. Okay, so now I imagine I'm working a cash register, and then I've touched things and everything. Oh, but now you know what? I'm just gonna wash my gloves. No. Gloves like this, or gloves that are even for medical grade, are not meant to be washed. You're not supposed to wash them. One, you cannot get into all of the cracks like you would your hands. And two, these gloves don't fit exactly like a perfect second skin of another set of skin. They're not like surgical gloves. And even surgical gloves, when I've done surgery, I do not wash them. Again, we take them off and go. So there was a question of, we could wear them and that would be better. The problem is that when people wear gloves, and the data comes from healthcare workers, so healthcare workers are trained of how to use gloves. They're retrained on a regular basis. It's not normal for people to know how to do this, so we have to keep retraining and keep this, and this is with healthcare workers. If healthcare workers wear gloves, they wash their hands 35% less. So can you imagine the general public? If you wear gloves, you get this false sense of security that you are clean, except you end up touching your hair, touching your face, readjusting your glasses, and all having dirty hands. And that's what we're talking about, okay? We want to make sure that people are washing their hands, because you can't wash the gloves like you would wash your hands. Okay, so then people were like, okay, can you reuse the gloves? Not really, because I'm gonna show you how you actually take off gloves. And so how you take off gloves is not pulling by the little fingertips. No, it's actually picking up the side, pulling it off. You take that glove, you go in with your clean hand underneath, and then you put it in the garbage. And imagine that was a garbage right there, because we don't have a garbage right beside me. I didn't plan that in my demonstration. Okay. Then, they're all laughing in the room at me, of course. Okay, so now unfortunately these are even powdered gloves, so it's even worse, because now my hands, I actually do need to wash them. But for the sake of television, I'm gonna go wash my hands again, because after you take off gloves, what do you gotta do? You need to wash your hands again. So again, another 20 seconds of washing hands. Now, that leaves me, so basically, I would say don't use gloves. What's better is to be having the hand sanitizer right there, washing your gloves. If you're in a store that has an Interact machine or whatever they're called now, when someone just taps their card, I guess no one touches anything, but if someone's like entering in their PIN number and stuff, you should wash the Interact device, and then you should wash it after they've used it. That's better to do. That's actually how we do prevention of infection. Wearing those gloves will just give you this false sense that you're actually secure. Okay, so then the next goes on to masks. So people are saying on the CDC website that everyone should wear masks when out in public. Should I? Then it goes on to, there's another question that was related. It's understood that masks may be ineffective in preventing getting COVID-19, but do they help prevent those contagious from spreading it if they wear one? And why do so many Asian people wear them? Thank you. Okay, so again, this goes down to hand hygiene. So I just washed my hands, and you saw on that I touched nothing. So now I can go in and grab the mask. Again, these are from my husband's garage. He doesn't know I have them. You take them by the earpieces and you put them on. You can adjust your nose. You go on either side to adjust, okay? The problem is, and I'm gonna do all the things that people do. I see you all the time, and by the way, let's not use the bad word, I'm the person that tells you, oh, I'm sorry, you just used your gloves and touched something and picked your nose, and then you're touching everything else. I'm the person who says, you know what, you take your mask and you go like this because you wanna have a sip of coffee. You just contaminated your hand, and you're really not doing anything in terms of the protection. So if you touch your mask, you're only supposed to be touching the ears, okay? So I'm gonna take it off because it's irritating to talk with. And that's the other thing, is people will talk, so they'll just take it off one ear and balance it on one ear. No. Now, so people are saying on the CDC website that everyone should wear masks when out in public. Well, I looked on the CDC website, and I know people are saying this online, and there's like people referring to the CDC saying this, but when you actually go to the CDC website, and please correct me, and you can email the email address to correct me and show me the exact link, but everything that I read on the CDC website, and I checked just before coming, it says no masks for the general public. It only says if you have symptoms, and this goes on to the second question of if someone has symptoms, is coughing, should they wear one? And yes, then it would be a reasonable point to wear them, because you're actually preventing you from, when you cough, droplets come from your mouth and your nose and go into the air, and those droplets do have viral particles. The vast majority of them, do you know where they go? On the floor, because they are heavy, surrounded by liquid. Some of them can be very minute micro droplets and some potentially aerosols. But the chance of having me cough and having an aerosol fly 2 meters in the air and fly directly into your nostril, because actually the nasal mucosa is the most permeable to viruses and bacteria, is so unlikely. So that's why masks are not that useful. The other thing that we talk about is contact, and like, walking by I walked into a drugstore and I walked by a person and they were 2 meters away. I think they might have COVID, maybe I'll get COVID because it's just in the air. Well, there's a definition of contact. Contact has to be less than 2 meters, so basically it's like 2 arm lengths, and greater than 15 minutes is the number that we're usually using. So that's not the case for most times when you're walking through Walmart or wherever you're going, and you're only going there because you absolutely need to get something. All right, there's a huge amount of real publications about aerosolizing the virus. So taking COVID-19, which is not known to be an airborne virus, it is a contact virus. So it's transmitted by droplets. That's why coughing, and that's why it falls on if someone coughed, it would fall on what I'm feeling, and then it would go onto the floor. So that's why you need to clean surfaces. That's why you need to keep washing your hands, because your hands constantly touch surfaces. And when your hands touch surfaces, where else do they touch? Your face, your nose, your mouth. And people are like, no, I don't pick my nose. Do some human observation. I know you're at home right now, so you have to look out the window, but there'll be people around and they'll be picking their nose. People pick their nose all the time. And that's where you have spread of things. So the other most dirty place, so the only people that I think should be wearing masks are really healthcare workers or people that are symptomatic themselves. The healthcare workers, when they need to wear masks, it depends on, and this is what Lisa talked about in terms of community spread. And so I know that in the last couple of weeks, we've used community spread. We've tried to get you guys to stay home because we're worried about that. Currently, there is no data on community spread within Montérégie, and that's why it's not that healthcare workers you see on the general basis are not wearing masks. However, if you go to Montreal, there is definite community spread. And what community spread means is we can no longer trace the case. We can no longer say why this person got infected and then trace it to another person. When community spread, it's that we don't know where it's infected from. And that is the case in Montreal as well as Estrie. So that's why there, all of the healthcare professionals are wearing face masks. And actually, when you arrive into, for example, I also work at St. Mary's. If you walk into the St. Mary's emergency room, you put on a mask. Every patient, even if you were not symptomatic, obviously with a cough. Okay, so the only other place that I would say that you should wear a mask, and I'm stealing this from a colleague of mine, infectious disease, Dr. Telcher at the Jewish, is if you like and have a penchant for lying down in Walmart with your mouth open. So if you want to lie on the floor with your mouth open, then definitely you should wear a mask. I also think that you really should also speak to other people because there's probably other issues. By the way, this is all a joke. We do not lie down on stores. I know sometimes children do, so maybe this is a way of, well, one, when you go shopping, right now, try not to bring your kids. The kids should stay at home. So that's my little spiel about that. Now, about China and other Asian countries, where wearing masks has actually been de rigueur since well before COVID. It's been for years that people are wearing masks. Unfortunately, we have the data on that. Even though they had a culture to wear masks, they still got COVID. There was still high propagation until they did the lockdown. Now, why were they more successful in some places like South Korea than we are? Because we have a different definition and expectations on civil liberties. In Canada, we're not used to people telling us to stay in our house. It doesn't happen. In South Korea, other countries, you are told by the government to do something, you better do it. So that's one of the big issues. Okay. My next section is about immunology. So I just want to say that immunology is my least favorite subject. I feel there's 5 people in the world who give really good immunology talks. I am a virologist, not an immunologist, so I'm going to really be basic for you. So is there any worry that because the majority of the population is in isolation and we're constantly cleaning and washing our hands, that when we come back out into the public, our immune systems will have weakened from not being in contact with everyday germs? So I think it's a super interesting question. Overall, I'll say no. Because it's not like you were like this for your entire life. So if you had never, now we're talking about newborn babies, but again, we're gonna discuss about where all of the antigens, so that's the things our immune system encounters, that's little pieces of protein from bacteria, from dust particles, from everything, so that our body begins to recognize what is self, us, and what is not self, and then be able to create appropriate immune response. So from the moment we are born, and whether that's vaginally or by cesarean section, our body is encountering, the baby encounters bacteria. We actually have nice evidence. You can look at the mouth of baby at birth and later on, and then the feces of baby. Yes, people do these actual studies. It's super cool. And they can actually look at, over time, what kind of population of bacteria that are there on purpose to protect us. There's lots of places in our body that there's bacteria. There's bacteria always on our skin. It's needed there. It's actually helped. We have bacteria all the time in our gut. Those are the microbiota that's helpful and helps us digest our food. So we have all this antigen. So yes, at this moment in time, we are cleaning, but I don't think when you go outside afterwards, you're gonna be at any greater risk of infection. The only thing that you're probably at greater risk of is having very, very dry hands from washing your hands all the time. But for the short term, I think that's appropriate, and you can actually use, especially when you get home, you wash your hands with soap and water, you can put hand cream on, you can sleep. That's actually another point where you could use gloves. You could put gloves on with hand cream at night, and then your hands will be nice and hydrated in the morning. You can just use cotton gloves or your winter gloves to do that. You don't have to use medical supplies, and I actually urge you not to buy medical supplies because I need them. That's why I specifically brought you the non-medical supplies and non-medical grade things here today, because I don't want to waste any of the medical supplies, because we need them for in the hospital when we actually need them. Okay, for the elders that get the flu shot every year, does that not help their immune system to fight off viruses like this because it's the flu family? Actually, coronavirus and influenza are not the same family of viruses. It's sort of like I have a key to my house, you have a key to your house, my key opens my front door, your key opens your front door, but your key will not open my front door and my key won't open your front door. And so that's the same kind of thing. It's a very different virus, so there's no cross-reactivity. Having the flu vaccine, which is great, and I encourage that because we are still seeing flu, although we're not testing for it at the moment, but anyways, when we were still testing, there was still flu around. So therefore, I'm really happy that your elders got the flu vaccine, but it's not going to protect you for coronavirus. I'm going to talk about vaccines a little bit later on as well. Once you've recovered from COVID-19, can you contract it a second time? The answer is basically no. It depends on how long, because it takes some time for your body to build up the antibodies. So there's different levels of antibodies that are produced at different surfaces, and some of them are more long-standing than others. So those first antibodies that are produced in the secreting places in your mucosa of your nose and your mouth, those antibodies are less long-lived and not as effective, but the longer ones take about a month. So the IgGs take about a month to get it. So generally, yes. Now, there's always a possibility, just like SARS is actually in the same family and quite close in structure in relation to SARS-CoV-2, which is the new COVID-19 virus. However, there's no cross-reaction of the vaccine or any of the antibodies because they're not closely enough related. So there is a possibility of mutation of COVID-19, but it's such a slow mutation that I'm not worried about it for now. So basically, yes, you will get antibodies, but it will take time, and the time it takes depends on your immune state from the get-go. So if you're immunocompromised, you probably won't develop antibodies, or they won't be that. It will take a very, very long time. If you are older, we know that you take longer to develop antibodies. So basically the answer is yes, you shouldn't be able to be infected again, but it may take different amounts of time for different people. Okay, so my then section about, I called infectious disease. So why did this virus cause a pandemic when it sounds like pneumonia? Except pneumonia kills thousands more people a year than the coronavirus has. Okay, so one thing, it's just like a little bit of nomenclature, but pneumonia isn't contagious. I think you're talking about bacterial pneumonia that you take amoxicillin for, or azithromycin. That's bacterial. It's usually a secondary infection after having a viral infection. Now, the virus or bacteria can be contagious. The difference with coronavirus and a regular streptococcal pneumonia, so that's a bacterial-caused pneumonia, is that, or even influenza, is that there is a spread, and I'm going to get this into a little bit later, from low-level disease carriers, so we sometimes call them asymptomatic or very mildly symptomatic people, can spread to very easily to other people. And that's the problem is, so yes, it's true, the mortality rate from influenza is higher, but the problem is that we have more people being infected right now with coronavirus because it's being so spread so easily, and that's why we need to take these extreme measures of staying home. So the highest amounts of hospitalization rates are around 17%, and that's what we did the public health in Quebec did the analysis to make sure we have enough hospital beds and ventilators and so on. Currently, we're hovering about 7% hospitalization and even much, much lower than that ICU. The issue is that if everyone continued about their day and then they go around and have a little mild cough, they don't really feel that well, but they still go about their day, they still go to work because they don't want to, they don't want to take sick days, or they've used up their sick days, or they're worried about their kids and stuff. If they continue going about that, they're going to continue spreading coronavirus and this SARS-CoV-2 and to other people who will have a chance of being hospitalized. And if everyone needs to be hospitalized at the same amount of time, we do not have enough beds to hospitalize 7% of the population of Canada in our hospital beds. And that's the issue, is we can't overload the health system. So we're trying to, plank the curve, like people say, or flatten the curve so that less people are sick at any one time. And you've seen this, actually, of what happens if we don't do this. We see what happened in Italy, Iran, and now in the US. We see what happens when we aren't vigilant in our staying at home. Is this something we're going to have to fear every year? Is there a chance for future coronavirus outbreaks that will cause the community to self-isolate once again, or will it become a standard precaution in flu season like every year? I feel like this virus has been made out to be as bad as cancer and will haunt us every year to come. Okay, so this is a huge change. It's a huge change of how we live our lives, what we do on a daily basis. But it's not alone. There are a lot of emerging viruses. You have to think back 2 years ago only, Zika. Zika was all over the news. We talked about microcephaly, so that's babies born with very small heads. And why that was the case, and on my other, as Paul Graves said, that I should do a mini med course. I'll talk about why that is on another day, but that was a huge thing. If you go back even further, hepatitis C virus in the 90s, no one knew what that was. It was huge, and yes, it actually does cause cancer of the liver. That was big. Think back to the 80s, HIV. So this is not unusual. What's unusual is that for those viruses that I just named, Zika, hepatitis C, and HIV, they're bloodborne. So while we need to work in certain communities, and that's what we did to reduce bloodborne transmission of HIV and other bloodborne pathogens, the issue now is that things are spread by contact. And so that's why coronavirus being spread by coughing and contact, that's why we've realized that we need to really tackle this right now. Now, in terms of will something like this come back? So I don't know the exact answer to this at the moment. Usually, it's not going to be the same SARS-CoV-2 that will come out again. Now, because of the whole world and how migration works, I expect we're going to be seeing these SARS-CoV-2 effects for quite some number of months. Will the next pandemic be a coronavirus? I don't know. It's true that we had SARS, we had MERS, And now we're having COVID, and those are all coronaviruses, but there are just as many chances of other viruses coming out. And one of those things is, why is that? And there's lots of speculation, and I know that there's been some very good public health measures in a number of areas to reduce the reservoirs of viruses that are new coming to humans. So live animal sales markets have been closed, and we know that that's a place where you can have animal to reservoir, so they get the virus and maybe they don't get sick, transferring to humans. Because usually, and I think I mentioned last time about dogs and this COVID-19 doesn't affect dogs, it's because most of the time there's a species specificity for every virus. Okay, now I think I'm losing you, so let's go back. When the first case was detected, we were told there was no way the virus could have been transmitted because the person was not symptomatic at the time they were in the clinic. Having watched CNN and other news outlets, there's a lot of talk now about the people that can be asymptomatic. So what is that all about? What is the current information from reliable sources that asymptomatic spreading is possibility? It's very confusing, as we've heard, that you can't be tested until there are symptoms because the virus can't be detected until symptoms are showing. So the problem with testing before symptoms are showing is that you may have a false negative. And that's the problem with the test. And that's not because the virus isn't there. The test is actually great. It's 95% sensitive and specific, as I mentioned last time. The issue is that if you don't have enough virus in the back of your nose and the back of your throat and your sample isn't taken good enough, then you will not actually detect the virus. And we know from studies with other coronas as well as SARS-CoV-2 is that in the 48 hours prior to infection, up to 5 days, and then it can go on, but usually 5 days, it starts to go down. That's where you have the highest viral load. So it's the highest amount of virus that's seen shedding from your nose and as well as your bum through your poop. I'll talk about toothbrushes in a bit. Remind me to go back to that. So that's why when people are symptomatic or just before they're symptomatic, that's why we know when they're actually infectious the most amount. Now, people that are not symptomatic or, as I said, subclinically symptomatic, they have just the teeniest bit of symptoms. It's only when you go back in time if you actually can figure out if they actually had a little bit of symptoms or not. Generally, people who are completely asymptomatic even if they have virus, it's such a low level that it would be very hard to transmit. It wouldn't be as easy. Now, again, all of this, we're actually developing data day by day. We know that asymptomatic people, so about 30% of people, and this is the best data is out of South Korea where they tested en masse like everyone, 30% of people that were completely asymptomatic, they detected SARS-CoV-2 RNA in their nose and their bum. But we do not know if those people were actually infectious. We know that they actually had viral RNA detected, maybe, and they did do studies to show that viral RNA could be propagated, so make virus, but they don't show if those are actually infectious. So that's what the data is now. The worst part of when you're actually coughing is when you spread the most virus, and that makes sense for all pathogens, is when you're actually shedding actively is when you're most contagious to other people. So if a vaccine is created in under 18 months, is that truly long enough to know if it's safe and has gone through proper testing? So the general answer is yes, because we're not going to release anything onto the market that's not proven and safe. From my background in drug development, there's a very different process for vaccine development and development of small molecules. So like the drugs you buy at the pharmacy, even like Tylenol is considered a small molecule. So the way you produce the vaccine, it's really just a little bit of protein that's put in the body, and it's the body doing all the work, and the body is what's creating the antibodies that are going to protect you. This is down to a science, and they're not going to release anything that is not safe. We've been doing and developing antibodies and vaccines for years, and because of that, that's how we know how this process works. So the thing is that I wouldn't hang my hat on a SARS-CoV-2 vaccine for curing anyone or helping prevent anything right now, because we're not going to have it until a long amount of time. What I understand they're doing is, the idea is making a backbone of a vaccine that they could plug and play like they do with the influenza vaccine every year, so that you have the actual most likely antigen. most likely thing that will be specific to that version of the flu in that case. Coronavirus, as I mentioned, mutates quite a bit slower than the flu, so I don't know what's going to happen with that. But overall, the safety-wise, I'm not concerned about that. I wanted to mention something that no one asked a question about, but about passive immunization. So that's taking people who've recovered from coronavirus, and as I said, it takes about a month to get good antibodies, and taking their blood, basically purifying it, spinning it, and giving it to another person. So that's done in lots of different things. If anyone has been pregnant and they are Rh negative, they have to get something called RhoGAM, and that's basically the same thing as this process of giving passive immunization. So you basically give antibodies to a person so they don't have to make them themselves. The issue that I find with this, and they're going to have to, there's people doing work on this, is they're going to have to get not just any antibody, they're going to have to get antibodies that neutralize the virus. So actually stick to the virus and actually cause the virus to kill the virus. So that's still something that's working out, but it's interesting. Protecting the elderly immunocompromised. If you're an essential service employee and live with parents aged 70 and older, with or without health issues, should you make alternative living arrangements to protect them, even if you follow safety precautions? So I think it was just announced that there actually will be a place to live for the essential service workers. Again, it's about the contact with the public, and it really is about if you are in the 15 minutes less than 2 meters away from someone, so you have to watch how much you're working. But in terms of going home, now ideally, even without that, if you're not an essential service employee, if you live with 70-year-olds, ideally they would be in a separate part of the house, a separate room. It might not be always possible. If you needed to help them for their daily care, you will definitely have to be involved, but then the ideal is the person that's doing that primary caregiver or the two people, they are not going out of the house to get the groceries. That the groceries are brought by yet another family member and left on the front porch, and then they're decontaminated and stuff and brought in. So that would be the ideal situation. For the essential service workers, it's a little bit different because they actually have to work, and those we have made arrangements. If you need to go back home, it's some of the details that we've already sent you out of how to completely decontaminate yourself before going back into the home. By the way, there's no specific guides on where to live for even for at the Jewish, which is now the COVID Central, it has COVID wards. There's no specific guidelines to their employees of where they can live and if they have to separate. I know a lot of personally my friends who work on COVID wards have separated from their families, but that is not official guidelines. Okay. What can you expect to happen if we contract COVID-19 in terms of what we need to do just to mentally prepare myself, such as be aware of symptoms, call to be tested, live out the symptoms and feeling better, get tested again to be on the clear. Okay, so everything that you just said, except for the testing to be on the clear, is actually correct. So through the KMHC website, through Quebec.ca, there is a guide in French, it's called Auto Soin. It's a self-care guide. It explains if people that are coughing, have symptoms, no matter what, they should really self-isolate if you have those symptoms. And then in Kahnawake, you can actually come and be tested at our testing center. You self-isolate and you do all those things. So gentle hydration, making sure you feel well. You take acetaminophen for your fever or Tylenol for your fever. And that's basically it. They describe some more details in that guide and how to make sure that you're cleaning your hands well, and everything is all in that guide. Now, in terms of do we need to be tested to be clear? So the general population, no, you don't need to. We're not going to do a test of cure. Again, it's about samples and what we're going to get the best bang for our buck and the best amount of information. But if you're a healthcare worker, it's a little bit different. So healthcare workers, and there's clear guidelines on this, they are isolated from 14 days from the onset of symptoms, and then they have their COVID positive test. They can return to work only after currently 3 conditions are satisfied. So the absence of fever in the last 48 hours, the absence of acute symptoms in the last 48 hours, 2 negative COVID-19 respiratory tests. So they actually have to be tested to show that they are no longer shedding any virus. So this is how we know for sure that they are fine. And actually, even the guides, and these are guides that we have developed here, but also through the government, they even recommend that those people would be actually excellent people to be able to work on COVID wards because they have antibodies to COVID virus. Now, are we testing to make sure they have antibodies at the moment? No, but generally if you've cleared and you're 14 days, you're starting having those, anyways, I'm not gonna go bore you with the details of what types of antibodies, but you're gonna start with having those antibodies and then have the full-blown great antibodies by 4 weeks. Okay, I have seasonal allergies, and with this comes asthma that is often hard to get back in control. This seems to be what I'm experiencing, but should I go for testing? So, one thing, I have this Facebook rule of thumb. If someone's writing me an email or Facebooking, messaging me, they're usually well enough that they're not having like immediate respiratory distress and need to go to the emergency room. If this is not the case and the person who wrote this is really having trouble breathing, they should go see a doctor like immediately. Now, the other thing you can do is that this is sort of a more specific question, so going back to who to get information from. You can call your doctor knows you, you can figure out, is this the same? If you find that you're able to use your regular controller medications, maybe it is just your asthma. However, if your symptoms are worse than normal, maybe a little bit different than normal, then consider it and absolutely come and call and be tested. Some family members want to get together at 6 feet apart, have coffee and cake on the street. Is this safe and fair right now? So the main issue with, so yes, sort of, but not really. So the issue is that most people automatically start going closer together, especially if you have a group of like 6 people or 10 people, because you can't really hear what that person's saying, so you start to walk closer to that person. So that's the issue with people getting together. The other thing is that there's actually a law right now that there's no gatherings in Quebec of greater than 2 people. So it'd be hard to like get together, 2 people. So I guess, what people can do is, if you're dropping off groceries to your older than 70-year-old parents, you leave them on their porch, you go to the, ring the bell and then run to the end of the driveway. There, you did some exercise too. You run to the end of the driveway and you chat with them from the driveway. That's reasonable, but to like, sit down and have a real like big discussion like that, I think it's going to be hard. And it's natural tendency, because we are so close to our kin and to our friends, that we actually want to move closer to them. So it's hard to keep that distancing. So what I really recommend is if you have, if you only have a phone, call on the phone, FaceTime or Skype or any kind of efforts to be able to see them. I know, like from my own family, last week it was my niece's, oh my goodness, I don't remember her birthday. She was 11, sorry. Don't tell Viviane, I didn't remember how old she is. Her 11th birthday, we had a birthday celebration. So every family called in on FaceTime. We did a group chat. And they like blew out her candles and they sang happy birthday and they chatted like having a party, but everyone in their own house. Can I go for a walk or a run on the bike path, or go on to a nature walk either by myself or with the family of the people I live with? I think that's great. Yes, you should go do that, as long as you're not in self-isolation. If you're on self-isolation because you're COVID positive or you've returned from travel, then you're not allowed doing that. But if you haven't, yes, you can do that. Going for a walk with social distancing is a great for the mind and spirit. I've mentioned a couple times my COVID-19 anti-anxiety prescription, which is 1 hour of exercise, learning, creativity per day, and limiting COVID-19 related news to 1 hour per day. That's what I want you to do. That's actually, and so doing that exercise is going to be a great thing. Then someone asked if we had a side-by-side 4-seater ATV, can my family jump in it and go for a ride in the trails? Again, that's like these people that are together, if in the same family. So if it's random other people, no, but if they're in the same people. My issue with the ATV is like, do you have seatbelts and do you have like helmets and things? Because I've seen some bad things happen. I've had kids at the children's. It's not funny. So you really have to, you can do things within your family, but really it's about being within your family. And if you have to do it with your extended family, it's really doing it through phone and FaceTime and other means. My mother doesn't always have access to a vehicle. Can I pick her up and bring her to get her groceries out of town? No. I'm assuming your mother's over 70, but even if she isn't, you're not supposed to be with other people. It's better to be, so what you could do is call her ahead of time, FaceTime her, get her grocery list, go buy the groceries. At the grocery store, they still sell flowers. You could also add a bouquet of flowers. Your mom will be super impressed. You bring that, you leave it on her doorstep. You ring the bell, you go to the edge of the driveway, you chat like that. as a family, do we keep sharing toothpaste tubes, or should each family member have a separate tube? See, I remember I told you about that. I bring back to toothbrushes. You can share the tube of toothpaste. That's fine. But everyone should have their own toothbrush. I think that goes without saying, but I just want to say it. But the thing is, and it's not just for COVID-19, but for all sorts of things, I know different families are different things. You know, you either put the toilet paper over or under, and some people have the toilet lid up or closed. But honestly, infectious disease-wise, keep the toilet lid closed, because the toilet, flushing it, can aerosolize viruses and bacteria and all sorts of things. So let's keep the toilet lid closed to keep our toothbrushes clean, as well as the environment in the bathroom clean. While I'm doing this, by the way, my 14-year-old is at home cleaning my bathroom. It should be beautiful when I arrive home. I'm going to pay her, don't worry. Natural approaches and traditional medicine. So this is my last question. I got sent a video about natural medicines and traditional medicine, and I think this is a great approach. Unfortunately, I couldn't watch this particular video. I just got resent the link to where I could see it. But the overall thing is that you have to watch what's in some of the traditional medicines. If it's something that's been used for a long time, we know that it doesn't change any of your blood pressure medications and so on. That's okay, but there are some interactions. So I know that Candida Rice has put something on our website on traditional medicine, and so that's what I would encourage you to read. And I'm going to go watch those videos when I get home tonight. Thank you so much. Wash your hands. I wish you well.
Dr. Gauthier, and I'm not going to waste any more time because it's been a long week. As was mentioned earlier, this is the third week, the end of the third consecutive week. So we'll leave the last word to our Commissioner of Public Safety, Lloyd Phillips.
Thank you, Joe. Thank you, Dr. Gauthier and Lisa and the whole crew. We had quite a long show for today, and I'll be as brief as I can, just to recap. As everybody said, this has been officially week 3, actually week 4, since the hospital staff and public safety staff have been meeting to pre-plan for what we seen was coming. So it's certainly been a long run for us. And as we said before, the situation is very fluid. It's always evolving and changing, and new information is becoming available. And as the doctor just mentioned, some things that we assessing 3 weeks ago may not be 100% the same as we see today. That's because new information, new science is coming available to us, and new recommendations. Either through Dr. Gauthier, or we see from public health on recommendations on how the best way to continue to move forward. So things have been changing, have been evolving, and they will continue to evolve and change as the weeks go on. One thing, again, we're always looking at the numbers real quick. In the province of Quebec, the number is like 6,101 officially as of today, and almost half of that, 2,837, in the island of Montreal. And furthermore, as even reported on Global TV this morning, that even LaSalle itself is considered to be a hot spot, a hot zone within the island of Montreal itself, which we all know in Kahnawake is just across the bridge. That's a common area that we travel to pick up groceries or some other essentials. So just keep that in mind. We're discouraging people from going to that area. Stick in locally as possible. As we said several times again, shop Kahnawake as much as you possibly can. And if not, venture out into surrounding communities to pick up your essentials. Again, with that said, we had a discussion today at the task force, and we discussed the issue of the formerly called the CITSO bus, but now it's the EXO bus that goes from Agrion to the community, through the community, and back to Agrion. We are going to be reaching out to them as soon as possible, and we are going to be halting that service because again, we want to encourage people to stay local as much as possible, and it kind of goes against what we're trying to accomplish by encouraging people to go into the city, and in this case, especially into LaSalle, where it's definitely a hot spot. So giving people a heads up on that's something that's going to be coming very shortly. We also had a good discussion on further communications with external. The Grand Chief had mentioned earlier, he's reaching out to the mayors and other municipalities in the area to convey our message to them. We're also be looking at the large billboards that are happening, that are in our community, as you know, to utilize those much more to get the message on what Kahnawake is doing and some of the precautions that Kahnawake is taking to minimize, the spread in our community, including, discouraging people from coming into the community unless you have a proper reason for being here. We also talked about the signage, in which I spoke about this morning on K103, but we are going to be putting up various signages around the community that's going to be clearly stated that it's for residents only. And unless you're coming here again for a specific purpose, we ask you to just keep on driving by. You're welcome to use the bridge and the highways, but please stay out of our community unless you have a reason to be here. And if you're caught here, you will be issued fines. And with that as well, with the increase in people trying to come into the community, the peacekeepers will be starting to issue fines. They tried to speak to many people who informing them to leave the territory and don't come back and that sort of thing, informing them of the directives that have been issued. But there are some repeat offenders, and if they are caught again, they will be issued a harsh fine. It has come to that, and we'll do what we have to do to ensure that we're protecting our community to the best as we possibly can. With that, like I said, it's been a very long period of time we've been going through here, and where the end's going to be, honestly, we certainly don't know at this point in time. Hopefully, in the next week or so, we could have some projections on when we're going to reach that peak of on that slope, as we constantly talk about. It's difficult, and as the Grand Chief alluded to earlier, we see many crises in our community over the years, but this one is unique. We're fighting an invisible enemy. We're not only fighting the virus. We're fighting fear. We're fighting the anxiety, and we're fighting the loneliness that people are feeling. So those are things that we have to all understand, that we're all in this together, and we have to find a ways through to ensure we're supporting each other as best as we possibly can. And even though there's fear and sometimes maybe even some anger, people are feeling anger because they're impacted directly, on a personal level, on a financial level, or with their business. There's fear and there's anger, but we can't let those feelings guide our decisions. And here at the task force, we have those same fears and anxieties as anybody else in Kahnawake has. But we can't let that guide our decisions and our directions. Our ancestors always say, right, you have to lead with a good mind. So that's how we make sure we address issues with a clear mind, based on the facts, and based on what is best for the collective of our community. With that, I think I'll end here with just a very quick shout out to the Kahnawake Brewing Company, who has produced hand sanitizer, which they'll be distributing out through the community, as well as the 207 Steak and Seafood for providing lunch and dinner service for the frontline workers. Again, that community spirit is alive and well, and I appreciate all you're doing for your community. With that, I'll see you again soon. Onigwahi.